Welcome to the Deep Dive. We get straight to what matters, helping you make sense of things. Today, we're looking at something really fundamental for your health: primary care. Specifically, clinics and polyclinics. We've got some great material you've shared, and our aim is, well, pretty simple. We want to pull out the key differences, what they actually do, and help you figure out when each one makes the most sense. So yeah, let's get right into it.
Absolutely. And it's clear from the information that primary care is really that first step in looking after your health. It's where you usually go first for any health worries,
Yeah.
before you end up needing specialists or hospital care. And the resources point mainly to two types: clinics, often run by a GP, general practitioner.
Your family doctor type, yeah.
Exactly. And then polyclinics, which are generally larger and have, more specialists available. Both are usually right there in your community, designed for those everyday health issues. Kind of like a clinic is your local corner shop for health basics.
Okay.
And a polyclinic is more like a department store, maybe more services all in one place.
That's a helpful picture. Okay, so let's look at clinics first. What are their main features?
Right. So a clinic is typically smaller. You might find just one doctor or perhaps a small group. The focus is usually general medicine, like you said, the family doctor feel, though some might specialize, maybe a skin clinic or something similar. And appointments, well, sometimes you can just walk in.
Yeah.
The material mentions.
And the services, what can you actually get done there?
Mostly general consultations, talking to the doctor, getting checked out. And they can handle minor procedures too. But, and this is important, the sources stress this, access to specialists or more advanced tests like detailed blood work or x-rays, that's usually limited.
Limited, okay.
Yeah, you probably need a referral to get those done elsewhere.
So what are the upsides then? Why choose a clinic?
Well, the personal touch is a big one mentioned. Smaller place, you might build a better relationship with your doctor. They could also be less busy than bigger centers, maybe quicker to get seen. And generally, the consultation fee tends to be lower.
Those are definite plus points. But the downsides: when is a clinic maybe not the right call?
The main thing is just the range of services. Like we said, they aren't set up for complex diagnostics on site or seeing specialists right away. So if you need more investigation or specialized care, you'll be sent elsewhere. Referrals are key.
Right. Okay. So pulling that together, when does it make most sense for you, the listener, to head to a clinic?
It seems like clinics are really ideal for those more straightforward health issues. Basic stuff. When you need affordable care, and maybe you really value having that one doctor who knows you well, that personal connection.
Makes sense. Okay, let's switch gears then. Polyclinics, how are they different?
Well, the big difference is scale and scope. Polyclinics are larger facilities, and their defining feature is having multiple medical specialties all under one roof. The sources describe them as much more comprehensive.
Comprehensive, okay.
And like clinics, they usually offer walk-ins and scheduled appointments.
So different health issues potentially all handled in one location.
Exactly. The service range is significantly wider. You got your general doctors, but also specialists right there, in-house. And crucially, many have their own diagnostic facilities, blood tests, x-rays, that kind of thing, often done on site.
So you don't necessarily need that extra trip for tests.
Precisely. They're also highlighted for doing comprehensive preventative health checks, full checkups, and handling minor procedures too.
So the main pros of a polyclinic, what stands out?
It really boils down to that one-stop shop convenience. Having specialists and diagnostics right there. That's a huge plus, especially if you've got complex needs or just want things done quickly.
But what about the drawbacks? Anything to watch out for?
Well, the material suggests they can sometimes be a bit more expensive than your standard clinic visit.
Oh, okay. Costs could be higher.
Yeah. And also because they're bigger and busier, that very personal one-on-one doctor relationship might feel a bit diluted sometimes, less personal perhaps.
So thinking about the listener again, when would a polyclinic be the better choice based on what we've discussed?
It seems like if you know you need to see several different specialists, or if you're managing chronic conditions, things like diabetes or heart issues that need coordinated care, a polyclinic is probably more suitable. Or even if you just really value the convenience of having tests and preventative checks all done in the same place.
Got it. So we have clinics for simpler personal care and polyclinics for broader, more integrated services. But the sources also talk about when to seek primary care in general, right? Whether it's a clinic or a polyclinic, what kind of situations are we talking about?
Yes, definitely. For all those common things that crop up, a fever, cold, cough, sore throat, maybe a headache that won't quit, feeling tired,
The usual suspects.
Exactly. Mild tummy issues, skin rashes, minor allergies. For those, a general doctor, whether in a clinic or polyclinic, can usually examine you, suggest basic medicine, and give advice. They're well equipped for that.
And what about ongoing health issues, longer-term stuff?
Right. Things like high blood pressure, diabetes, thyroid problems, asthma. These often need regular check-ins, maybe medication tweaks. Primary care facilities are absolutely central to managing these conditions effectively.
Okay.
The sources also mention follow-up care, say after you've been in the hospital or had surgery. For simple things like checking a wound or a basic review, you often don't need to go back to the big hospital.
Ah, so your local GP or polyclinic doctor can handle that sometimes.
Often, yes. For the routine stuff. It saves you a trip and potentially frees up hospital resources too.
That's really good to know. And it sounds like primary care is also the place to start if you just feel unwell but aren't sure why.
Precisely. If you've got symptoms, but no clear idea what's causing them or which specialist you might eventually need, a visit to primary care is the right first move. They can do an initial check, maybe order some basic tests, and then guide you, point you in the right direction. Whether it's more tests or a specialist referral, they're like the gatekeepers, in a way.
But crucially, there are times when a clinic specifically is not the right place, isn't there? Emergencies.
Absolutely critical point. The sources are very clear on this. If you experience severe symptoms, think really bad chest pain, sudden weakness down one side like a stroke symptom, heavy bleeding that won't stop.
Serious stuff.
Very serious. Difficulty breathing, losing consciousness, or, say, major complications in a high-risk pregnancy. In those situations, you need immediate hospital emergency care. Call an ambulance or get straight to an ER. Clinics are just not set up for that level of emergency.
Okay, that's a vital distinction. So let's try and summarize the key takeaways for everyone listening. What should you really remember from this?
I think the main messages are clinics and polyclinics are both incredibly valuable. They're your first port of call for mild illnesses, for managing those long-term conditions, and for just getting general medical advice.
So use them first for non-emergencies.
Yes, try primary care first before heading straight to a hospital unless it's clearly serious, but, and it's a big but, know those red flag symptoms. Recognize when something is serious and needs immediate hospital attention. Don't delay.
Right.
And finally, a practical tip consistently mentioned. Always try to bring your previous medical reports to your appointment and be ready to explain your symptoms clearly. It really helps the doctor help you.
That's been incredibly helpful, really clarifying the roles of these two types of care. Thanks for breaking that down.
My pleasure. Happy to help.
And thank you for tuning in to this deep dive on primary care choices. As you think about this, maybe reflect on your own past experiences seeking medical advice. Knowing what you know now, how might this shape your decisions next time you have a health concern? Definitely some food for thought. We'll catch you on the next deep dive.